Greetings to everyone. Welcome to our YouTube channel. Today we will discuss about lower limb fractures. चलिए आज हम स्टडी करेंगे lower limb fractures के related. First one we will discuss about awareness of classifications of various lower limb fractures. Understand the general medical surgical management of fractures and rehabilitation. To understand the management of the following conditions. First one, hip fractures. Second, patella fractures. Third, femur tibia fractures. And fourth, ankle fractures. जैसा कि आप स्क्रीन पे देख रहे हैं hip fractures. Then we will discuss about treatment goals. First one, orthopedic include ligament stability. Then functional goals, normalize the patient, create patterns, achieve 90-degree hip flexion for proper sitting position. Then expected time of bone healing, 12 to 16 weeks. Then expected duration of rehabilitations, 15 to 30 weeks. Then we will discuss about surgery. Most hip fractures will actually heal without surgery, but the problem is that you will be in best for 8 to 12 weeks. Doctors have learned over the years that placing an aging adult in bed for the period of time has a far greater risk of creating serious complications than the surgery required to fix a broken hip. We will discuss about weight bearing. जैसा कि आप स्क्रीन पे देख रहे हैं, फर्स्ट वन मेटल से क्रू है एंड सेकंड इंट्रामेड्यूलरी नेल है. देन नॉन वेट बीरिंग है. फर्स्ट है मेटल प्लेट एंड स्क्रू. सेकंड है ही माइट थ्रो प्लेसी. देन वी विल डिस्कस अबाउट एक्सरसाइज. देयर आर टू टाइप ऑफ एक्सरसाइज. दो किस्म की एक्सरसाइज होती हैं. फर्स्ट होती है क्लोज चेन और सेकंड होती है ओपन चेन. क्लोज चेन में क्या होता है हम बताते हैं आपको. फिक्सेशन प्रॉक्सिमल एंड डिस्टल, वॉल साइड स्क्वाट्स. Then open chain, no fixation of distals, legs or biceps curls. Then exercise include laying in bed when laying on your back, position a pillow between your legs when laying on your back. Keep the surgical hip position inlet to the keep and twice to positions and ceilings. Last one, avoid letting your foot roll inward and outwards. A blanket or towel roll on the outside of your leg may help you maintain their position. Then we will discuss about general medical surgical management. First one, reduce fragments, prevent further injuries. For example, vascular injuries, avascular necrosis, soft tissue damage. Then prevent deformities, allow early mobilizations. And second one, embolize fractures. Prevent displacement, angulations of fragments, prevent movements that will affect union, and last, reduce pain. Then we will discuss about methods of immobilization. First one, plaster of pairs or external splint like brace, back slab. And second, continuous tractions. Methods of immobilizations include third one, external fixation, and fourth, internal fixation. Then we will discuss about test of union. Clinical and radiological tests are used to ensure that the fracture is united. Then clinical, there are three types of clinical. First, absence of mobility. Second, absence of tenderness. And third, absence of pains. Then radiological X-ray criteria. Visible callus bridging both fragments. Continuity of bone trabeculi across the fracture. Then we will discuss about bone healing, जिसमें इंक्लूड है फेसिस, सेल्स एंड टाइम फ्रेम. फेसिस में आता है इन्फ्लामेटरी फेस, सॉफ्ट कैलुस फेस, हार्ड कैलुस फेस, रिमोल्डिंग फेस. इन्फ्लामेटरी फेस सेल्स के रिलेटेड है. इन्फ्लामेटरी फेस में जिसके अंदर इंक्लूड है नेक्रोटिक सेल्स, हाइमाटोमा एंड फिब्रिंग क्लॉट फॉर्म टू ब्रिज गैप. एंड टाइम फ्रेम में क्या है, इमीडिएटली. देन सेकंड फेज सॉफ्ट कैलुस फेज. सेल्स की बात की जाए तो फाइब्रस एंड इंक्रीज सेलुलर प्रोलिफरेशंस. ऑस्टियोक्लास्ट रिमूव डेड बोन फ्रैगमेंट्स. इसमें टाइम है 1 to 6 weeks. Then third phase, hard callus phase, calcification of fibrocartilage into bovine bones, osteoclasts and osteoblasts. इसमें टाइम है 4 to 6 weeks up to 3 months. लास्ट फेस है रिमोल्डिंग फेस. रिकॉन्स्टिट्यूटेड फ्रैक्चर डायामीटर डिक्रीज टू ओरिजिनल विड्थ. टाइम की बात की जाए 6 weeks to months years. Then we will discuss about rehabilitation goals. Early phase control swelling and pains. Second, preserve function while the fracture is uniting. And third, restore function to normal when the fracture is united. Duration of rehab dependent. Intrinsic and extrinsic may take months to years. Then we will discuss about rehabilitations. Active use of other joints without compromising the healing of the fractures. Preserve joint mobility. For examples, Colles fractures, stiff shoulder elbow must be done to prevent joint contractures. And gradual activities used of injured part without risk. For example, compression fractures, trunk extension and posture. Then active exercise of muscle and joint prevent atrophy. First one, static muscle contractions. Second one, split remove start gentle joint mobilization. Progressive resistive exercise when fracture is united. And then ambulate. Most internal fixated fractures are allowed to begin dependent on surgeon orders. If only on external fixation, maintain cardiovascular fitness. Then we will discuss about proximal hip fractures. जैसा कि आप स्क्रीन पे देख रहे हैं, डिफरेंट टाइप्स की हिप फ्रैक्चर्स बोन्स हैं. Gordon's classification of neck of femur fractures. Then we will discuss about dynamic hip sacro, cancellous sacro. Phase 1, acute impatience to 3 weeks. Second one, impairments. Phase 1 include post on day 1 to week 3. Goal, first one, reduce pain. Second, reduce swelling. Third, promote bed mobility and transfer. 4, improve hip range of motion as tolerated. And 5, gait training with walking aid as appropriate. Phase 2 goals. First one, increase hip range of motion. Second, increase lower limb strength. And third, progress gait may increase weight bearing status depending on surgery. Phase 3, week 8 to 12, impairment may include a poor lower limb strength, decreased balance, reduced endurance. Then goals. First one, increase lower limb strength. Second, increase balance and stability. And third, increase walking endurance. Then we will discuss about proximal tibial fractures. Fracture does not extend the knee joint like rod and sacro. And second, fracture extends into the joint, plate and sacro needed. Then we will discuss about proximal tibial fractures rehabilitations. What do you think will be affected? How would you plan your rehabilitation process? First one, consider the phases of bone healing. Consider extent of fractures, soft tissue injuries. And third, consider fixation stability. Fourth, consider intrinsic and extrinsic fractures. And fourth, any other things. Then we will discuss about tibial femur shaft fractures. आप स्क्रीन पे देख रहे हैं tibial femur shaft fractures bone. Then we will discuss about tibial femur shaft fractures rehabilitation. Question है, what do you think will be affected? Joints, muscles, circulations. How would you plan your rehabilitation process? Last one है हमारे पास ankle fractures. Different types की होती है, Weber A, Weber B and Weber C. जैसा कि आप स्क्रीन पे देख रहे हैं. आई होप ये और इन्फॉर्मेशन आपके लिए हेल्पफुल होगी. थैंक्स फॉर वॉचिंग दिस वीडियो.